And there are growing concerns now about a new disease linked to these insects. Joining us now with more about all of this is Dr. Peter Krause from the Yale Public School of Public Health. Peter Krause, thank you so much for being with us.
Hi, Erin. Nice to be here.
So just a couple weeks ago, actually, my 5-year-old had a tick bite, which we sent in for testing, and learned that this is actually a very active tick season. So tell us a little bit more about the disease and why this really is such a serious threat.
Sure. Well, most people are familiar with Lyme disease, but there are a few other organisms that are transmitted, or a few other diseases transmitted by the same Ixodes scapularis tick, which is also known as the deer tick or black-legged tick. In any event, babesiosis is one of these infections. It's important. It's a worldwide emerging tick-borne disease caused by tiny parasites that infect red cells. And it's important because it can be very severe in immunocompromised individuals.
Have there been any cases of this so far in Connecticut?
Actually, Connecticut has had several hundred cases reported each year for the past 10 to 20 years. In the last few years, there are about 200 to 300 cases reported, which represents about 10% of all cases, a little more than 10% of all cases reported in the United States. There are about 2,000 cases reported in the U.S. each year.
If people do get a tick bite, they see a tick bite on their child, they see a tick bite possibly on a family pet, what are the symptoms they should be looking out for here?
Well, the symptoms of babesiosis are somewhat generalized. That is, the symptoms are similar to those one might see with a summer viral illness, with Lyme disease as well, but there's no EM rash, no erythema migrans rash. So the common symptoms would be fever, chills, sweats, fatigue, headache, poor appetite. And again, these are symptoms that you might see with a number of other diseases. But if these symptoms persist, and people in Connecticut are susceptible to babesiosis, that's something that they should think about. Certainly individuals who are immunocompromised, people at the extremes of age, so newborn infants or people over the age of 60, people who have HIV/AIDS, people with cancer, people with immunosuppressive therapy, people who lack a spleen, which is an organ in the abdomen that helps screen the blood. Any of these individuals need to be very aware. If they have fever, they need to see their physician and think about this possibility.
Something I thought of after recently going through this with my daughter, and thankfully we were able to get the tick off of her within about 15 minutes or so. Does the length of time the tick is maybe infecting the person or potentially engorged contribute to a worse effect of this particular disease?
Well, it's a very important point you're making. It takes 36 to 72 hours to transmit babesiosis. The tick, if you pull the tick off within 24 hours, you don't have to worry about this disease. That's also true of Lyme disease. So in terms of if the tick's on for longer, I think the chance that it's going to transmit increases. But I think that that the idea that if you can get that tick off early on, that may prevent you from getting a tick-borne disease.
I know we talk about it all the time, but how important when you come in from the inside, do those skin checks, and we all advocate for that, but then sometimes it doesn't come to fruition. So hopefully this is a good reminder to people, check yourselves when you're coming in from the outside and long grass and things of that nature. Dr. Peter Krause from the Yale School of Public Health, thank you so much for your insight and expertise. Very eye-opening. We appreciate it.
Thank you, Erin.